Hi, I'm David Snead. I'm a consultant histopathologist in Coventry in the UK. I work at the University Hospital Coventry in Warwickshire for the Coventry and Warwickshire Pathology Services. I am the lead consultant pathologist in charge of digital pathology and have a number of research interests, largely in lung pathology and in lung cancer in particular. Pathology at the moment is under immense stress in the United Kingdom and indeed in most of the health economies. The reason for that is there's an expansion in demand. With an ageing population, we are dealing with more pathology per person than we used to. We need more pathologists, we need more reporting time to deal with the cases that are coming in, and that's presenting us all with an enormous challenge. In the UK, funding has been capped and we have no increase in funding to go alongside the increase in demand. So the mantra in the UK at the moment is delivering more for less. So innovation really has, it means lots of things to different people, but in cellular pathology, what we're looking at is digitising cellular pathology, and that opens up a number of really big opportunities, both to automate the specialty and to improve the outcome you get from your pathologists on the specimens that are submitted to them. For many, many years, pathologists have been aware of their limitations in making fine judgments on the cases that they look at. One of the things we find particularly difficult is quantifying anything with great accuracy. We can make quite good measurements and so on, but what we can't do is measure the degree of abnormality that exists within a specimen. We can recognise the abnormality, we can categorise it, but actually quantifying how bad it is a judgment, and those judgments differ between individuals. So digital pathology offers a means by which those judgments can be quantified by computer algorithms very accurately, and we think that will lead to improvements in patient diagnosis and treatment options. Digital pathology also makes the work mobile. We can send the work anywhere in the world to be done, and that opens up a number of opportunities to use our consultant workforce in a much more flexible and efficient way than we do at the moment. So really, in cellular pathology, innovation means getting more out of our pathologists, increasing their productivity through digitisation. So in the future, when we think about what things will be like in 5 and 10 years' time, for example, we're really thinking that there will be a lot more automated computer analysis of tissue sections than there is. Well, there isn't any at the moment, or very, very little at least. We think a lot of things will be done by computer algorithms. For example, categorising normal biopsies from abnormal. Normal tissue, for example, is very regular. It has its own microanatomy, which is highly reproducible because it's normal. That's the way it always is. Therefore, designing algorithms which recognise that and recognise anything which varies from that, categorising it as abnormal, is a reasonably straightforward thing to do, and will enable us, for example, to take out about a third of our endoscopic biopsy workload from the pathologist's tray. That will all go through the computer, and it will decide which of those are normal or abnormal. And the pathologist will then just look at the abnormal ones and decide what's going on and make his usual diagnosis. So to summarise, really, what we're saying here is digitisation is a key part for innovation in cellular pathology. It paves the way to increase performance for pathologists in terms of giving better diagnoses, more reliable diagnoses and predictions on how the patient's going to do. It makes the workload mobile so that we can increase productivity from our pathologists, and it paves the way for automation for a lot of the tasks that we do day in and day out.